If you're new to Medicare, you've probably heard people talk about parts A, B, C, and D, but what do they actually mean? In this video, I'm going to break down each part in simple terms so you can understand how Medicare works and what options may be available to you. My name is Jacob Abundis and I'm an independent licensed health insurance agent. So Part A has to deal with hospital insurance. So Medicare Part A helps cover inpatient care. This includes skilled nursing facility care after a hospital stay, hospice care, and some home health services. Most people don't pay a monthly premium for Part A if they or their spouse paid Medicare taxes while working. However, Part A does have deductibles and cost sharing depending on how long services are used. Now, looking into Part B medical insurance, Medicare Part B covers outpatient and medical services. This includes doctor visits, preventive care, lab work, durable medical equipment, and outpatient procedures. Part B does have a monthly premium, which is typically deducted from Social Security benefits. There is also an annual deductible and usually a 20% co-insurance for covered services after the deductible is met. Okay, now with Medicare Part C, which is Medicare Advantage, is an alternative way to receive your Medicare benefits. These plans are offered by private insurance companies approved by Medicare. Medicare Advantage plans must cover everything that Parts A and B cover, and many plans also include additional benefits such as prescription drug coverage, dental, vision, hearing, and wellness programs. Costs, provider networks, and benefits vary by plan and location, and enrollment is optional and subject to eligibility requirements. So now going with Part D, Medicare Part D provides coverage for prescription medications. These plans are offered by private insurance companies and help reduce the cost of prescription drugs. Part D plans have their own premiums, formularies, and pharmacy networks. Coverage and costs can vary, so it's important to review medications annually to ensure they're still covered. So this is an important reminder. Everyone's Medicare situation is different. Cost coverage and eligibility can vary based on location, income, and individual needs. All right, let's take the time to go into Medigap. So Medigap is a private insurance designed to help fill the gaps in original Medicare, specifically Parts A and B. So original Medicare doesn't cover everything, and Medigap can help pay for costs like deductibles, co-payments, and co-insurance. But Medigap works alongside original Medicare. Medicare pays its share first, and then Medigap policy may help cover or all of the remaining approved costs depending on the plan. So Medigap plans may help cover Medicare Part A hospital coinsurance, Medicare Part B coinsurance or co-payments, blood costs, skilled nursing facilities, coinsurance. Some plans may also cover Part A deductibles or foreign travel emergency care. Coverage depends on the specific Medigap plan letter. Medigap plans are standardized and identified by letters such as Plan A, Plan G, or Plan N. This means that a plan with the same letter offers the same basic benefits regardless of the insurance company, though premiums can vary. Not all plans are available to everyone, and availability can depend on when you enroll and where you live. What Medigap does not cover: Medigap plans generally do not include prescription drug coverage, dental, vision, or hearing benefits, long-term care, routine transportation. Prescription drug coverage is typically obtained through a separate Medicare Part D plan. So enrollment with timing does matter. The best time to enroll in the Medigap plan is during your Medigap open enrollment period, which begins when you are both 65 or older and enrolled in Medicare Part B. During this time, you may be able to enroll without medical underwriting. Outside of this window, acceptance and pricing may depend on health history. So now let's look at Medigap versus Medicare Advantage. You generally cannot have both a Medigap plan and a Medicare Advantage plan at the same time. Medigap works only with original Medicare, while Medicare Advantage is an alternative way to receive Medicare benefits. Now, this is an important reminder. Medigap plans, benefits, cost, and availability vary by location and individual circumstances. So some of the pros of Medicare Advantage, of course, depending on location, area, and place, is that Medicare Advantage plans often have a lower premium than Medigap plans, and it could be from little to no cost. Medigap plans typically have a higher monthly premium, especially as you age, and most Medicare Advantage plans include Part D prescription drug coverage in one plan. With Medigap, prescription drug coverage must be purchased separately through a standalone Part D plan. Now, Medicare Advantage plans may offer extra benefits such as dental, vision, and hearing coverage, fitness or wellness programs, transportation for medical visits, or over-the-counter allowances, while Medigap plans generally do not include these additional benefits. Medicare Advantage plans include a maximum out-of-pocket limit for Part A and Part B services. Once this limit is reached, the plan pays 100% of covered services for the rest of the year. Original Medicare paired with Medigap does not have an out-of-pocket maximum through Medicare itself, though Medigap may help cover any costs depending on the plan. And of course, as we know, Medicare Advantage often bundles Part A, B, and D with the additional benefits. So many Medicare Advantage plans operate with provider network and may offer care coordination, which can help manage chronic conditions and streamline care among providers. Medicare Advantage plans can be reviewed and changed during the annual enrollment period each year. This allows beneficiaries to adjust coverage if their needs change. Medigap plans are not typically changed annually and may require medical underwriting if you attempt to switch plans later. Coverage, benefits, and just an important reminder, coverage, benefits, costs, and provider networks vary by plan and location. Medicare Advantage is not a one-size-fits-all solution, and what works well for one person may not be the best for another. If you need any help or have any questions, leave a comment down below or go ahead and reach out, and I'll go ahead and get you the information that you need.